Hello, everybody. Thank you for joining us today. We're going to give everybody just a minute to get in here and then we'll begin. Okay, welcome and thank you for joining us for this webinar on the Walk Cares Fund. Today we'll be covering Walk Cares Basics, what near retirees need to know. My name is Sam and I am the Walk Cares Fund Communications and Marketing Manager. I'm joined here by Sebastian, the Walk Cares Fund Outreach and Language Access Lead. Today, we will be hosting today's presentation. The DSHS customer care team will be answering questions in the Q&A function during the presentation and will be joining us later on for the Q&A portion of the webinar. Anybody who has joined us on a computer or using the Zoom app on their phone can submit their questions through the Q&A function at any point during the presentation. If we're unable to answer your questions during the allotted amount of time, we will email a response to you to the email that you registered with. This webinar will be recorded. The recording, along with the slides, will be available on our website at walkcaresfund.wa.gov/webinars within 24 hours of the completion of today's presentation. And with that, I'll pass it along to Sebastian, who will start the presentation by defining long-term care and caregiving.
Thank you, Sam, and good morning, almost afternoon to everyone. Thank you for being here and joining us today for this webinar. So yeah, let's go ahead and start with defining long-term care and caregiving. So what do we mean, right, by long-term care and caregiving? So starting with long-term care, that is help with activities of daily living, and that can include bathing, eating, dressing, preparing meals, grocery shopping, and many others. It does not include, however, medical care. So that would be things like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, that includes for younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize as well how many different services and supports are included when we talk about long-term care. So we might often think of it as care in a residential setting. It can be a nursing home or assisted living, but it does also include care provided in our own homes. And in fact, most people with long-term care needs can stay in their own homes with these right types of supports and services. It's also very common, and we see frequently for family caregivers to not realize that they are a caregiver. So just as a general definition, a caregiver is a person who tends to the needs or concerns of a person with short or long-term limitations due to illness, injury, or disability. So for example, you might go to your mom's house a couple of times a week to cook meals, drive her to appointments, and make sure she's taking her medications, all of which are common care activities. And the majority of this type of care is provided on an informal basis, meaning unpaid care from a family member, a friend, or a neighbor. So we're going to go ahead and launch a poll here that you should be seeing pop up on your screen, just to get a sense of the group's experience with long-term care and caregiving generally, and also our familiarity with the Walk Cares Fund, how much we might already know or have heard about the Walk Cares Fund. So please take a second to answer those two questions, again, just to get a sense of where we're all at here today with those two topics. And if you did join by a computer or through the Zoom app, if you appreciate it, if you could go ahead and answer to help us learn, again, more about who we all have here today. So we'll have the poll up here for a little bit longer. and then we'll see what sort of results we get. All right, so it looks like initial results are in. So thank you for those of you who were able to participate in that poll and answering those questions. So for the first question about our experience with long-term care and caregiving, looks like a large number of us have provided unpaid care to a family member or loved one in the past. So a lot of us, almost or over 40% of us, are maybe personally affected by this. We also have about a quarter of us that don't have direct experience and are not familiar with long-term care. So also we'll be providing a lot of information, background around these topics here in a second as well. So that should be helpful. And another big part of this group works in long-term care or related field. So again, very closely related and knowledgeable around the topic. And then we also have, regarding our second question, how much do we know about Walk Cares? The Walk Cares Fund looks like over half of us are somewhat familiar, and then another quarter of us not very familiar, and then another group very familiar. So excellent. Thank you all for answering those questions, and it's good to know who we have in the audience today. So we're going to go ahead and take a look at an example of who Walk Cares, the kind of families that Walk Cares will be supporting. So family caregiving is really the bedrock of long-term care, and we have about 820,000 family caregivers in the state of Washington, which comes out to just about 11% of the population. So this story that we're going to share next is from a Washington family doing the kind of caregiving, again, that Walk Cares will support. So this is Sunny and Yenny, sisters and nurses who live in the Puget Sound area and care for their mom, who is experiencing a cognitive decline. So let's go ahead and take a look at their story here.
My mom was a nurse anesthetist in Korea, and we're both nurses, so it kind of runs in the family.
So that was part of the reason why we were able to come here in 1974, because she had worked as a nurse and they wanted nurses to come, so she was able to bring the whole family.
Just a couple of years ago, we started noticing that my mom started to have some cognitive decline, kind of on the spectrum of dementia. Yenny and I have had to kind of put our jobs on the back burner to really help take care of my mom.
Some days were good, some days were very difficult. I mean, it's our mom, and there's nothing I wouldn't do for her to make sure she stays as independent as possible with the support that we can give her.
If we had a resource like Walk Cares, that would have been so helpful to just kind of ease some of our financial burden in trying to do this. It's very difficult. So we try to simplify her life. We do her grocery shopping, and she often will come with us, and cooking, cleaning, cutting her hair, taking her out socially, but we're creating meals that she is familiar with and that she enjoys. And we like to bring her out to do fun things too, and not just like all medical all the time. Believe me, it will affect you, whether you're younger or older, to have a resource like that and to know that the state is investing in families. That means a lot to me. Walk Cares is a program that I think will benefit everybody.
All right. So what we're going to do next is talk a little bit more about and provide information around the cost of caregiving and the impact it has on workers, families, and communities in our state more generally. So 70% of us will need long-term care at some point in our lives. And the problem is that long-term care, as a lot of us know, can be really expensive. So it costs almost $36,000 per year for 20 hours of home care per week, which is the average that is needed by a current Medicaid long-term care client. And it's also important to keep in mind that family caregiving isn't free either. And we'll talk about a little bit more about that here in a second. Because long-term care is not medical care, like we mentioned at the beginning, it's not covered by health insurance or Medicare, except in some very rare circumstances. And it's only covered by Medicaid after you've spent down your life savings to just $2,000. So even though we know it is a predictable cost, the reality is that most of us still don't have a way to pay for that. So the median household income for Washington seniors is just about $56,000 per year. So 41% of Washington workers near retirement have no projected retirement income from a pension, 401k, or an IRA. And another 42% have no pension and only enough 401k or IRA savings to replace just 10% of their pre-retirement income. So alone, those numbers are quite significant, but if we combine those two groups, that comes up to just about 83% of Washington workers between the age of 55 and 64 that have either no pension or savings or just enough to replace that 10% of their pre-retirement income. And this is especially significant as well when we relate it to the population and how it is aging rapidly, particularly in our state. So this is what you see there is a graph, of course, of our of the population and how it will be aging, again, specific to the state of Washington. And we're here in 2025. If we follow that blue line, which is the number of people 85 and older, we see how that line significantly starts to increase and will more than double between the years 2020 and 2034. And the caregiver support ratio is declining sharply, which means that a lot less family support will be available for people in high-risk years for needing care. And family caregivers will be more likely to be providing care for multiple loved ones at a time. So just looking at this graph here, we see that there's, on the left-hand side in 2010, 7 potential family caregivers for each person who might need care. If we slide over to 2050, then that ratio drops right to 3 potential family caregivers to 1 person needing care. So really, as a society, we need to provide better support for caregivers and find new ways to help those families with long-term care needs. And while walk cares may seem like a new expense for workers, it's important to keep in mind as well that the current system of relying on unpaid family caregivers to provide the vast majority of care isn't actually free for those families. So almost half of family caregivers experience some financial setback. Caregivers spend, on average, about 25% of their own income on care-related expenses. And it's also really common for caregivers to leave the workforce early to provide care. Caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. And most working caregivers say that a program that would have paid them for the hours they provide, like Walk Cares, would be helpful. So we're also going to take a look at here the impact it has on businesses and workers more broadly. So we see in Washington State, like the rest of the country, is experiencing a labor force shortage. So job openings are increasing, but the number of available workers is not. So with this kind of shortage, it's critical to keep as many people as possible in the workforce, and the care responsibilities can have a big impact on that. So the majority of caregivers work full-time on top of their care and family responsibilities, and most report it impacted their job responsibilities in some way. Over half say that they have to go in late, leave early, or take time off to provide care, and 15% also reported reducing their hours. About 8% reported receiving warnings about their performance or attendance, turning down a promotion, quitting, retiring, or losing benefits. And while many caregivers find their role rewarding, it can also be highly stressful. So nearly 1 in 4 report their health has also worsened since taking on the role of a caregiver. And long-term care is also a significant driver of the state budgets and accounts for roughly 8.9% of the state budget. So we don't often think about it, but the costs are paid for by all Washingtonians through the taxes on goods and services. So as our population ages, the costs will also rise. And without the WA Cares Fund, sales and other taxes would have had to go up significantly to meet the needs of our aging population. So if we think back to that line graph where we saw the blue line go up and double between 2020 and 2034, that would be, the direct impact. So with all of these challenges in mind that we've just covered, as well as facing a projected doubling of the Medicaid long-term services and support costs by 2040, Washington State's Joint Legislative Executive Committee on Aging and Disability began a search in 2014 for a long-term care public policy that would preserve and protect the Medicaid program budget, that would also offer affordable long-term services and supports and insurance coverage, provide financial relief to middle-class families and their caregivers, and be financially viable and sustainable in the long run. So the Joint Legislative Executive Committee spent several years working with stakeholders, with policy experts, and actuaries to explore different private and public solutions. And after this extensive research on each of the approaches, the findings were clear that a program like the WA Cares Fund that covers everyone, so similar to how Social Security and Medicare operate, is the only way to provide affordable coverage for all. And we also know that universal coverage, where everyone participates in the program, is a best practice in public pension, healthcare, and long-term care insurance programs in other capitalist countries throughout the world. So it ensures programs can cover everyone at a low, stable rate, regardless of their age, their gender, or their health status. And so with all that research and the best practice in mind, in 2019, the legislature enacted the LTSS Trust Act, which created WA Cares. In 2021 and 2022, the legislature made improvements to the program's coverage and benefits, which we'll be talking about shortly as well. And workers began earning benefits in July of 2023. And last year in 2024, the legislature gave workers the ability to take their benefits out of state, which is something, again, we'll focus on towards the end of the presentation. And in July of 2026, the benefit will become available to those who qualify. And we'll get into who qualifies here in a second as well. So let's talk about the WA Cares Fund and how it works and how it can help. So WA Cares is a universal long-term care program in Washington State. It's an earned benefit, which means that you contribute for a certain number of years to qualify for the benefit. It's entirely self-funded from worker contributions, which go into a dedicated trust fund used only for this program. So as you can see on the screen there on the slide, workers contribute 0.58% of every paycheck to WA Cares. And we can also see what that looks like for a typical worker who makes just over $50,000 a year. So that typical worker would contribute $291 in a year, which comes out to about $24 a month. And you only contribute while you're working. So contributions are stopped when you retire or if you become unemployed. And everyone is covered at the same rate, regardless of any pre-existing conditions. So when it comes time to claim your benefits, there are no copays, no deductibles, and you never need to file a claim or pay upfront for services. Instead, we connect with the contracted providers for the services you want, and WA Cares will pay them directly. And contributions to the program, again, begin in July of 2023, and the benefits will become available in 2026. Go back one slide here. So let's take a look at who is contributing to the WA Cares Fund. And that is almost all Washington workers are contributing to WA Cares. To determine whether someone counts as a Washington worker, we look at whether their work is localized in the state of Washington. And determining whether work is localized in Washington can be complicated, but because we use the same definition as the state's paid family and medical leave program, that gives us an easy rule to work from, which is that workers who are included in paid leave will also be included in WA Cares, unless you have an approved WA Cares exemption from the Employment Security Department. If you're not sure whether you participate in paid leave and WA Cares, you can check your pay stub or ask your employer for more information. If your work is not localized in the state of Washington, you are automatically not included in paid leave or WA Cares and don't need to file for a WA Cares exemption. A few others who are not automatically included are federal employees. Employees of tribes are only included if the tribe opts in, and self-employed people are only included if they also opt into the program. Other workers can get an exemption from WA Cares, which they must apply to through the Employment Security Department. And there's also some workers who can apply for optional exemptions based on meeting certain conditions. So some of those optional exemption groups include workers who live out of state, temporary workers with non-immigrant visas, and spouses or registered domestic partners of active duty military. And these three exemptions were created for groups of workers who would be unlikely to qualify for and use their benefits. So they are available on an ongoing basis and are conditional. So the person must continue to meet the exemption criteria in order to maintain that exemption. And there are also two types of permanent exemptions. So one of them being for veterans with a 70% or higher service-connected disability rating, who have access to some nursing home care through the VA. They can choose to apply for a permanent exemption, and these applications are available also on an ongoing basis. And there was also an exemption available in the past for workers who had private long-term care insurance before November of 2021. And these applications are no longer available. So under current law, workers who already have an approved private insurance exemption will continue to be exempt permanently. So for more details on applying for an exemption, you can visit our website, wacaresfund.wa.gov/exemptions, where you'll find all these details as well. So if you are self-employed, you can choose to opt into the WA Cares Fund, as we mentioned earlier, and protect yourself with the same affordable benefits available to other Washington workers. So just like other workers, you would contribute the same amount, so 0.58% of your earnings. And this includes your net earnings and any gross wages that are paid to you from your business entity. So to earn benefits, you must work at least 500 hours per year. And for self-employed people who elect coverage, this is calculated by dividing your gross annual wages by the current minimum wage. So for example, let's say you retire and choose to start some sort of business after retirement. As someone who is self-employed, you could opt into WalkCares and continue to earn qualifying years in the program. Again, if you worked at least 500 hours per year. And then in the next slide, we'll talk more about how to qualify for benefits and the pathways to qualify. And applications to opt in became available in July of 2023, and again are available on an ongoing basis. All right, so let's take a look here at the 3 contribution pathways. Of course, we'll focus. I'll start from left to right, and we'll spend some more time on the pathway for near retirees. So everyone who is contributing to the WalkCares Fund more than 500 hours per year is earning benefits, part-time and temporary workers included. So by contributing for a certain number of years, you earn access to the $36,500 benefit. And these are the 3 pathways, again, to meeting the contribution requirement. So the first one on the left there is the lifetime access, and this is a pathway we expect that the majority of Washington workers will use to qualify for benefits. To use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you the access to the full benefit amount, which is $36,500, which is adjusted for inflation each year. The pathway in the middle there is early access. So this is for workers who maybe have not yet earned the lifetime access, but have a care need while working or soon after leaving work. So to qualify for this pathway, you need to have contributed for at least 3 of the past 6 years at the time that you apply for benefits. And this pathway also earns you access to the full benefit amount of $36,500. And finally, we have a special pathway just for people near retirement. So if you were born before 1968 and are therefore near retirement as the program begins in 2026, and unlikely to qualify for that 10-year pathway, you earn 10% of the full benefit amount for each year that you work. So I'm going to go ahead and just repeat that one more time. So if you were born, and again, this is specific to the near retirees pathway, if you were born before 1968 and are near retirement as the program begins in July of 2026, you earn 10% of the full benefit amount for each year that you work. So as an example, if you work and contribute for at least 500 hours per year for 3 years, you'd earn 30% of the benefit amount, so 10% for each of those years, which comes out to just under $11,000. That amount is also adjusted for inflation. And near retirees will have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. So of course they're able to qualify for or through one of the other pathways if you met those requirements. So if you retire, let's say, and continue to work part-time, right, assuming that we work at least 500 hours per year, you would continue to earn those qualifying years. Okay. Next, we're going to talk about how we can use the benefit. So once you meet contribution requirements, like we just took a look at, and need help with at least 3 activities of daily living, you can access your benefit amount, which can be $36,500 for the full benefit amount worth of services and supports. Again, that is a lifetime benefit that will increase over time with inflation. So with Walk Cares, you get the flexibility and freedom to choose the services and supports that best meet your need. So that could be in-home or residential care, but could also include things like home modifications to make your home safer, assistive technology for things like medication reminders and fall detection that can help with some of those care needs. And Walk Cares is really designed to help people age in place in their homes as long as possible. And really, that's what most of us want to do, and most of us can if we have the right supports in place. And Walk Cares has many options to provide support for family caregivers, as well. So you can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, including your spouse. The Walk Cares helps lessen the impact on family caregivers by paying them for their time or making sure that they get other support services as well. So we'll take a look at some examples, not to read through all of this, but just to get an idea of how far the benefit can go, which is a question that we get asked a lot. So it won't cover 100% of care for everyone, but it would cover the amount of in-home care for the average Medicaid client that the average Medicaid client uses for roughly a year. About a third of people need care for a year or less, and for those people, Walk Cares may be able to cover that care need. For others, though, Walk Cares provides the family with immediate relief and really time to plan for future care costs as well. So again, these are some examples of how someone might be able to use their benefit. They could pay a family member to care for them for about 10 hours per week for 2 years and get care supplies, which comes out to $33,500. Or they could choose services to help them stay safely in their own home. So they could purchase renovations, $15,000 worth of renovations, including bathroom modifications or a wheelchair ramp to improve their home's accessibility. Also get an electric wheelchair or scooter and have meals delivered for 3 years, which comes out to $26,800. And wanted to also share the great news from our last legislative session of 2024. The legislature passed a new law allowing people to take their Walk Cares benefit with them if they move out of state. So this is the newest improvement to the program. So under this new law, starting in July of 2026, Washington workers can choose to continue participating in the Walk Cares Fund if they move out of state. So in order to become an out-of-state participant, you must have contributed to Walk Cares for at least 3 years. And again, in which each of those years you worked at least 500 hours. And also must opt in to the program within a year of leaving Washington. So this can also be especially relevant, right? If, let's say you were born before 1968 and have contributed to Walk Cares for at least 3 years, again, working at least 500 hours per year. And let's say you decide to retire in a different state, maybe move closer to grandkids. With this improvement, you will be able to take those benefits with you, right? And like other workers, out-of-state participants will keep contributing to the fund during their working years. So the state will create a process for out-of-state participants to be able to report their earnings and pay premiums, again, with focus on making it easy, of course, as easy as possible for participants. And benefits for out-of-state participants will become available starting in July of 2030. All right, coming up to the end here, just for the Q&A, just to give a broader sense of the program. It is a cross-agency program, and multiple state agencies have responsibilities in designing and developing, as well as implementing the program. So if you have questions about exemptions or opting in, the Employment Security Department would be the right place to go. If you have other questions, you can always connect with Department of Social and Human Services. And you'll also work with DSHS, or the Department of Social and Human Services, in the future as you apply for benefits and get a care need assessment. We also have the Healthcare Authority, which is responsible for paying providers. And the Office of the State Actuary is responsible for the ongoing analysis to make sure that the fund stays on solid ground financially. All right, and with that, that is the overview of the WA Cares Fund. And next up, we'll jump into the Q&A.
Great, thank you, Sebastian. We're going to move on to the Q&A portion, as Sebastian mentioned. As a reminder, please submit all of your questions through the Q&A function located at the bottom of your screen. If we don't have time to answer your question today, we will respond to you in an email through the email that you registered for today's presentation with. And our first question is, how does an independent contractor sign up for the program? How and when do they pay?
So as an independent contractor, you would need to, again, opt into the program. And that can be done through ESD, who handles the opt-in process. I would also recommend looking on our website, wacaresfund.wa.gov/self-employed, where you'll be able to find more detailed information about that process. But you, as a self-employed, or generally, you will be able to and can opt into the WA Cares Fund. Yeah.
There's a few questions about slides, and I'll just answer that really quick. Today's slides and a recording of today's webinar will be available on our website within 24 hours of the completion of today's webinar. The near retiree pathway does not make sense to me. Can a near retiree earn 100% of the benefit if they worked 3 in the last 6 years versus only 70% if they worked 7 years?
Yeah, and let's go ahead and we can jump back to that slide, because I know for me at least, the visual is helpful. So yes, for near retirees, in addition to being able to qualify for a percentage of the benefit amount, if you were born before 1968, you can of course still qualify for the full benefit amount through the other 2 pathways. So if you did contribute 3 out of the last 6 years, let's say, and then have a care need, then you could access the full benefit amount. As well as if I mentioned, if you maybe retire and continue working either part-time or maybe start your own business, and you could also qualify through that 10-year pathway as well for the full benefit amount. The near retiree pathway allows for, of course, near retirees, folks born before 1968, to be able to access some of that benefit amount that they've been contributing to since 2023.
What year does the near retiree benefit count start in? So how do you determine when does their 500 hours start?
Yeah, so contributions started for everyone, for all working Washingtonians, in July of 2023. So that's the start of when we can start counting our qualifying years. So again, someone who applies for benefits and gets approved for benefits next year when they are first available in July of 2026, that person could earn 30% of the benefit amount if they're a near retiree, or like we just mentioned, if they have a care need, immediate care need, then they could access that pathway for the full benefit amount.
How do you determine if a person meets 3 out of 6 activities of daily living, if they qualify?
Yeah, great question. So there will be a care needs assessment. So that is a process and a policy that is still being worked on. But there will be a care needs assessment that will help determine again those activities of daily living that you might need help with. And again, to qualify, you do need at least 3 activities of daily living, in addition to have met the contribution requirements.
Will recipients be able to choose their provider or receive services or will they have to receive services through those that are contracted?
So recipients will be able to choose who their provider is. Again, WalkCares will work with those providers directly to pay them directly, which allows for the beneficiary to not have to be mediating that process and make it easier ultimately for the beneficiary. But yes, whoever the provider that is chosen, WalkCares will be able to work with them. And that includes, again, like we mentioned, someone could be a family member, a neighbor, right, a loved one. All those folks would be able to be paid providers for within the program.
And you get credit for a partial year worked.
Uh, yes. So the big piece to that is the amount of hours worked within a year. So again, you need at least 500 hours per year in order for it to count as a qualifying year. So if you worked that many hours, at least 500 hours, let's say in the first half, and maybe didn't work the second half of the year, that would still count as a qualifying year. So really, it's making sure that the amount of hours, 500 hours, is met within a year.
Do you have information on family caregivers and how I can pay a family member for care?
Yeah, so that process is still being worked on as well. So there isn't specific details. There are a few paths being looked into, but it is a process that is being looked into, um, and that will be able to allow, of course, for folks to pay family members for the care that they're providing. Yeah.
Is the year considered July through June for a full year?
So the year is a calendar year, so January to December.
Sorry, I'm just reading through some of these. If someone only works until July of 2025, are they eligible for 20% of the benefit if they were born before 1968?
Yeah, you could be, again, the key part to that piece will be the amount of hours you work. So if you worked, let's assume, or let's say that you worked 500 hours in 2024, as well as 500 hours in that first half of 2025, then yeah, that would mean that you would earn qualifying years for both of those years, even if it was only up until July of 2025.
Is the requirement of working 3 out of the last 6 years based on when you apply for benefits? For example, I will have
Yeah.
paid 3 years, but I will retire next year and probably won't need the benefits for another 10 years.
Yeah, so the middle pathway that we took a look at earlier was for folks that have an immediate care need, right? So for folks that maybe have an emergency and need to access the benefit for a care need, if those folks who need care more immediately contributed 3 out of the last 6 years or earned 3 out of the last 6 years, then they would access the full benefit amount. Otherwise, through the near retiree pathway, if you were born before 1968, then you would have access to that, the percentage based off how many qualifying years you have. And that amount is, again, a lifetime benefit, right? So you will have access to that amount that you earn for the rest of, right? And you'll be able to access that at any point that you do need care, even if it's not immediately when you retire.
Are people who are already retired eligible for benefits?
So in order to be eligible, right, there is those contribution requirements. You have to have contributed, right, if, starting in 2023. So if you retired after 2023, there is potential to have earned qualifying years. But again, since contribution started in July of 2023, that is when folks who retired after that will be able to access partial or the full benefit amount, depending on their situation and contributions.
Can a retiree pay in to qualify for additional years?
So you can't pay any additional to add years. Again, if you are working part-time or are self-employed, because maybe you started a business, then again, you could continue to contribute. But otherwise, there is an option to contribute additional in order to earn more qualifying years.
I will just add some of your questions are very specific to your personal situation. And those will follow up with you in an email after the event so we can give you personalized response. There's also some questions about reporting and different things that our Employment Security Department handles. We will take those questions and forward them over to them, and they will respond to you via email. Fortunately, we don't have an ESD representative on the webinar today. But if you did have a question and it's not answered live, you will get a response via email. If you are a veteran and did not opt out of WellCares, how does that affect your benefits?
Let me just think about that one for a second. So if you are a veteran and have been contributing, then again, of course, you could access the benefit amount through one of those contribution pathways. Maybe we can follow up, Sam, with that one. I'm just trying to remember specifically that veteran pathway in terms of exemption, and I just want to make sure I get that right. So
yeah, no problem.
I'd prefer to follow up. Thank you though for that question.
Can you define working hours versus hours worked? So how are hours worked calculated?
Yeah, so hours worked, obviously for someone who is employed, then it's the hours that you work. I want maybe the question is referring to self-employed folks, and that is calculated by your gross wages divided by the minimum wage, and that's how many hours are. That's how the hours are calculated for folks specifically that are self-employed.
I think the remaining questions will have to follow up with you in an email. Feel free to continue submitting your questions through the end of today's webinar. And if you have a personal question about your personal situation, definitely we will follow up with you via email. It's just a little hard to respond to everyone's personal situations on the webinar. Sebastian, did you want to go to the benefits?
Yeah, let's go ahead and just do a little recap. I know we've covered a lot in these slides, so just to provide a little recap. So of course you may benefit directly from WA Cares, and that goes either by receiving care yourself or getting help caring for loved ones. WA Cares may also impact at your work for coworkers, right, and caregiving with some caregiving responsibilities to be able to get some more support. And WA Cares will serve as a financial resource for families. So the ability to make a loved one a paid caregiver will help keep the benefits that workers earn in the families in their own communities. And WA Cares will ensure that workers throughout the state can access affordable long-term care coverage for the first time. And will also lower the cost of long-term care spending that we all pay through taxes, like we saw. And lastly, WA Cares will help Washington families meet the challenges of our aging population and ensure that workers have more choices to help them live with dignity and independence as they age. So that is all we have for you today. We do have a survey that we'd like to go ahead and share with you.
Yeah, we would love to hear from you, and I would appreciate any feedback you can give us. If you could take a few minutes to share your thoughts about today's presentation, the survey will automatically appear on your screen once you leave the meeting. Thank you all again for joining us today. As a reminder, this webinar was recorded. You can find the recording and information about upcoming webinars on our website at wacaresfund.wa.gov/webinars. The recording, along with the slides, will be available within 24 hours of the completion of today's presentation. If you have any additional questions, you can contact us by phone or email with the information listed on your screen. Again, if you did submit a question through the Q&A function, we will reach out to you directly. And thank you all again, and have a great day.
Thanks, everyone. Take care.